All right. I know some of us have some time constraints, so I will jump right into everything. Um, we have a good group of people already here. I am so grateful. I just want to say, just welcome to our Progressive Power Hour and our Mental Health RCV one-on-one discussion tonight. Um, Before we dive into this important conversation, what I really want us to do is just invite us all to take a moment to just pause, to be intentional about this space, to take a few slow, deep breaths together. So I just want to have us just take the time to close your eyes for just 2 minutes. And I'm just going to gently guide you all with some gentle breathing techniques. So I can set a timer for about 2 minutes. And then as we are taking this time, I just want us to think about what does mental wellness mean to you? What are some of the things you do, big or small, that you do to take care of your mental health? Um, and just take the time to just be with yourself. And it's just about 30 more seconds. Right. Hopefully that was a good way for us to move into this discussion. I hope that people feel a lot more decompressed. 2 minutes feels like a long time when we live in such a fast-paced society. And it's one of the main reasons why mental wellness is so important to me because times are so fast. We have technology all around us. And sometimes we just need to take those moments to be with ourselves, to hear ourselves breathe, and to just be intentional. So we'll go ahead and we will move along in the agenda. Our first speaker, I'm going to have Karen jump in and she's going to introduce our first speaker of the night.
Thank you so much, Kalandra. Good evening, everyone. My name is Karen Guzman. I'm Vice President of Advocacy for the Prince George's County Young Democrats. And tonight, I'm really honored to introduce our first speaker. It's Delegate Jamila Woods, representing District 26. Delegate Woods is a strong advocate for public health and mental wellness, serving the residents of District 26 with a deep commitment to community-centered legislation. Really excited to have you join us today, Delegate, and we'll let you take on the presentation.
Good morning, excuse me, good evening. As you can see, I'm completely lost today. Good evening. I'm not sure why my picture is not showing up. I apologize. Can you all hear me?
Yes, we can.
So I am certainly honored to have this opportunity to share with you this evening, and am equally honored to have the chair of Housing, Health and Government Operations, my chair, whom I completely love, respect, and hope to make proud, Joseline Peña Melnyk. I'm glad to have that opportunity. I apologize. We are having a shelter in place tornado watch right now in my area. So that's why I had to literally shift. They told us we had to move to the basement and all of that good stuff. But anywho, let me tell you a little bit about me. I was born Justine Stewart. I was not born Jamila Woods. I was born Justine Stewart. I was raised in foster care for the first 12 years of my life. I experienced every type of abuse that you could possibly imagine in in a foster care situation, in a situation where I was placed with the understanding or the belief or the being told that this was the best place to help me to grow as a child and to become the young adult and woman that would be a successful person. Well, I experienced every type of abuse you can imagine in foster care. That included sexual abuse, physical abuse, emotional abuse, spiritual abuse. Needless to say, I started acting out because for me, survival meant people not being able to take advantage of me, which is what I was used to. Survival meant becoming the person that the people who were treating me like, to become that person so that I could have power over people and not people have power over me. And so I grew up with the experience of people constantly asking what was wrong with me. I got in a lot of trouble, y'all. I probably made up some of the trouble some of y'all got in later in life. I got in a lot of trouble. I made a lot of bad choices and a lot of bad decisions. I grew up in a time period where people weren't asking the question, they were constantly asking the question, what's wrong with you? What's wrong with you? And it wasn't until I was a full-fledged adult that I came to understand the new question, the new research, the new understanding of how we address mental health. And that was asking what happened to you. And so when that hit me, I began very, 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 very discreetly to share my story with other people, talked about, some of the things that were happening to me. But even then, even after that point, even at a point where maybe I believed I could be rescued, I could be helped, I ran into huge roadblocks. One of those roadblocks was my parents used to send us to church every Sunday. They didn't send us to church every Sunday because they wanted us to learn about God, and this is me talking, they wanted us to be better people. They sent us to church because they wanted us out the house and they felt like they needed a break, and so they sent all of the foster children to church. And I liked it. I got involved in church. I love to sing, I love music, and so I got involved in as much as I could. And then I found myself starting to want to get involved in everything, to the point that it became a fault. And what I learned was the reason I was trying to get involved in everything wasn't, again, because I wanted to be a better person, but because I wanted to get out of the house. And so that became my defense mechanism, running away from people, places, and things by involving myself in other people, places, and things. Needless to say, that's a place where, in a space where you can get very hurt and very bruised and very abused. When I finally got to the point, and this is at a very young age, this is under 13 years old, I wrote a letter to the pastor of my church. And I told him about what was happening in our house. I told him about the sexual abuse. I told him about the physical abuse. And that pastor brought that letter to my house. And I'll never forget sitting behind the wall. We had a partition that separated our living room from our dining room. And listen to my pastor telling my parents, my foster parents at the time, reading the letter, and they're all laughing. And they're all talking about my imagination and all of these crazy things about me and, how I just let my mind go away. And I'll never forget when that pastor left, that my mother told me. It was the first time I heard it, but certainly not the last. And I'm sure many of you have heard it also. What happens in this house stays in this house. Long story short, Justine Stewart probably is the face of ACEs, adverse childhood experiences. Justine Stewart experienced so many negative things coming up and growing up that she became two different people. She became the person that wanted to save the world, and she became the person that completely could not trust other people, did not believe that I could be the great person that, people like my chair tell me I can be, right? Justine Stewart went through all types of challenges and situations. And it got to the point that Justine Stewart would look in the mirror and she would see a monster, literally see a monster, not an individual, but a monster. It took many, many years for me to get the help and the support that I needed. And you have to understand that this was a time when mental health was not a major priority. This was a time when the things that I complained about, I was told I was too young. I used to have physical challenges, physical ailments, and I was told I was too young to have all of these because no one then tied mental and physical health together. No one understood that they are one entity, that there is one health, and that it is our job, it is our charge, it is our responsibility that we are looking at the holistic person. And so that's why I'm excited to be a part of a conference like this, of a conversation like this, that makes sure that we put mental health as a top priority, combining with physical health. When I came into the legislature, I begged, borrowed, I was willing to steal to be a part of the Health and Government Operations Committee. This is the truth. And I remember people telling me that this was a prestigious committee that everybody wanted to be on. And because I was a newbie, it was highly unlikely that I would be on this committee. And I have to say this because I do still believe in God. I still do believe that God makes a way out of no way. I winded up being selected to be on Health and Government Operations. And this has given me a wonderful opportunity to be able to be that advocate that lets people know that when we look at health, we have to look at it from every aspect. And that is why for the past 2 sessions, I have put forth legislation to try to make mental health evaluations for children a part of a physical. And I'm not talking about you go to the doctor and the doctor says, are you sleeping at night? Are you eating well? They ask 3 or 4 questions and they consider that a mental health examination. You all know as well as I do that children need a biopsychosocial evaluation. I think adults need it too. That's just me talking, Chair Peña Melnyk. I think we all need it. I think it all needs to be a part of our physical because so many people have had unknown mental health crises taking places in their life. And I'm sorry, that's another one of those warning signs. I'm so sorry. We are in the middle of an emergency alert in my area. I'm sorry. And that's why it is so important that we take serious consideration of mental health issues and mental health challenges, that we make all available services, as a matter of fact, available to our children, to our young adults, to our youth, into adulthood. These are things that really in the last decade or so have become a fierce priority. And we have to continue to work on because we saw an increase of mental health challenges as a direct result of COVID. We saw what the isolation did. We saw what people being at home. We saw what parents experienced about their own children that they didn't even know because their children were going out of the house every day and going to school and dealing with challenges like bullying and other things taking place in school that the parents couldn't believe because they didn't see that particular component of their children's behaviors and actions in the home. And I always laugh because I work in child welfare, and I always laugh because I hear parents saying, oh my God, I did not know this about my child. Like their teacher deserves an Academy Award because I didn't know that this is what they were dealing with until they had to deal with their own children in the home. And so I am here today to talk about how we must continue to strategize, how we must continue to advocate, how we must continue to work together to address all of these mental health factors, how we must make sure that there are adequate mental health evaluations in place, that there are adequate services. We know that there's a shortage of mental health providers, and it is our responsibility. It is my clarion call to make sure that we get people put in place in the state of Maryland who can address these mental health challenges with our children, who can follow them, Joseline Peña Melnyk, our chair, she worked so hard to make sure that these pediatric overstays in the hospitals don't take place because people are stuck there because of mental health challenges that their parents or their foster parents or their group homes don't want to address. And we have to make sure that we are putting these services in place to assure that the needs of our young people are met, body, mind, and spirit. So that is why I'm here. I'm happy to entertain questions and turn it back over to you.
Thank you so much, Delegate Woods. I resonated with so much that you said. And you're absolutely right. We need more mental health access. We need more providers, and we need more people advocating for these issues on a state level, on a national level, on local levels. One thing I forgot to mention in the beginning is that another reason that this means so much to me is because I am myself neurodivergent and I've dealt with my fair share of mental health challenges and trying to find the right person to connect with as a provider. And it's hard, especially for people in the African American community. So I appreciate all the work that you do and the work that Delegate Joseline Pina Melnick does as well. We are going to move to Delegate Jocelyn, but we're going to come back so that people can ask you questions. Is that okay? Okay.
Absolutely. Thank you.
Thank you so much. Karen?
Thank you so much, Kalandra, and thank you so much, Delegate Woods, for your powerful testimony and story and sharing your perspectives with us. I'm really honored to introduce our next guest, Delegate Joseline Peña Melnyk from District 21. She's the chair of the Health and Government Operations Committee. In this role, Delegate Peña Melnyk has been a leading voice in healthcare access and mental health equity across the state of Maryland. And with that, I turn it to you, Delegate Peña Melnyk.
Thank you, Karen. I appreciate you. And Kalandra, it is a blessing to see you and everyone. I want to thank the Prince George's County Young Democrats for having me. I certainly don't take it for granted. It is an honor to be here and to follow my sister from another Mr. Delegate, Jamila Woods, who I love. I love you as a person. You have an incredible story, which is a story of determination, resilient, and faith. We need all of that and hope, especially during these times. And I love serving with you. When you put in a bill, you do it because you care. You do it from experience, and it really makes a difference. And you really enrich my experience as a legislator in our committee. So thank you. Thank you for being you, and don't ever change, okay? You are a true blessing. I am very committed to mental health. I basically know what it's like to need services, to not be able to get services, to not be taken seriously. I see a lot in my community as, an immigrant who came here when I was 8 with a single mom, who, we went through hell and back. We went through a lot. And as someone who lived in a room with my mom and my sister when we got here, who we put up with a lot. Someone who lived with my grandmother and my grandparents in the Dominican Republic in a little 3-bedroom house with, made out of wood, where the latrine was a hole, right? That you went to the bathroom, an outhouse where the toilet paper was corn husk, a newspaper. I have lived those social determinants of health. No one can tell me about that. I know what it's like to walk to school for more than an hour and to go to bed and not have food. I have lived that and experienced that. So when I legislate from experience. I legislate from the heart. I like to say that whether you're the nun, I had a nun that I was very grateful that sometimes gave me $1, sometimes gave me $5, and it came with a prayer. Or you give me $6,000, so I don't even know who gives me 6,000. They do. I don't want to know. It doesn't matter because I do it because it's the right thing to do. I get in trouble often because I speak from my mind, and that is the way to be, right? You have to be yourself. Life is too short. So when I legislate because I know it's important, and mental health is a priority for me. Mental health has to have parity with physical health, right? Mental health you don't take seriously because people can mask it. People can get up in the morning, put on their face and go about their day, but you don't know the hell that they're living and what they're going through. So I want to say thank you for creating a space where we not only talk about shaping a more just and vibrant democracy, but where we also take the time to uplift our shared humanity. So thank you for starting the meeting with taking 2 minutes. And I have to tell you, I force myself to clear my mind because it's always going and say, Joseline, stay in the moment, be focused and respect the space. And that was actually good. All right. And I thank you for that. So tonight we do just that, right? By recognizing Mental Health Awareness Month, I want to take a moment again to thank Delegate Wood for sharing your story. It is so passionate. You need to write that book. And I thank you for sharing it. I chair the Health and Government Operations Committee, and someone who has served on the committee since 2007. I have witnessed firsthand the transformation of mental health care in our state. Like Delegate Woods, I wanted to be on that committee. I was very intentional about that, and it's the only committee I have served, right? I have been moving gently and slowly, very slowly, through the ranks, and that's okay because I'm very outspoken, and sometimes that takes a little while when you do that. So when I began my legislative journey, mental health was often in the shadows. To be honest, it was chronically underfunded. It was stigmatized and disconnected from the rest of our healthcare system. It just simply was. But change is possible when we dare to believe that everyone deserves care. Everyone deserves dignity. Everyone deserves hope. Everyone deserves respect. And over these last 2 decades, Maryland has begun to build something better. I'm very proud in a very humble way of the work that we have done. We know now something we should have always known. The mental health is health. And just like any other part of the body, our minds deserve care, attention, and protection. This understanding has propelled us from reacting to crisis to investing in prevention, early intervention, and continuous support, which is so important. One of the most rewarding parts of this journey for me has been witnessing the shift in how we talked about and prioritize mental health. As a legislator and a mother and an advocate, this work is deeply personal to me. I know what it means to feel overwhelmed, and trust me, we're living it right now in this country. We really are. These are tough times for people. I get those calls. I have seen the emotional toll that untreated mental illness can have on families. And I have committed myself to changing the system for those who often feel voiceless and who often live in the shadows. The expansion of telehealth, which was one of the bills I introduced, and Delegate Woods voted for it and supported it, has been one of the most powerful tools. During the darkest days of the COVID-19 pandemic, when isolation deepens suffering, when, we didn't know whether we were going to survive, whether people were experiencing loneliness, where you had difficulty in having access to a primary care doctor, to a specialist. We lean into innovation. We tore down geographic, financial, and emotional barriers to make more accessible, to make healthcare more accessible, and to make it something that we expect, and that everyone can have access to it. So, for a student who was struggling with anxiety, a working mother that was battling depression, or a rural resident needing counseling, telehealth is not just technology. It is hope. It is healing. We have also taken bold action through the Mental Health Parity Act. And I have to tell you, regarding telehealth, this session we put in a bill to make it permanent, right? The insurance companies were saying the sky is going to fall. It's going to cost too much money. The doctors are going to abuse it. Guess what? We show with a study that that is not so, that the sky is not going to fall, that they're still making money, right? And the telehealth does help, and it does help, and it works. So we made it permanent. We got rid of the sunset, and it's permanent in Maryland, and they have to pay for it. But not only do they have to pay for it, they have to pay for phone calls, audio, and visual equally the same. And I fought hard for that bill. And Delegate Wood supported and helped me on the committee. We also took bold action through the Mental Health Parity Act, requiring that insurance companies treat mental health with the same seriousness as physical health, because an invisible wound can hurt just as deeply, because survival depends on access, and because justice demands equity, and that is important. Our work did not stop there. We worked on a bill that it's called assisted outpatient treatment. And it took us, get this, 24 years to pass that bill. And it's a bill that is needed. And by passing that bill, we created a compassionate path forward for those with severe mental illness who may not be able to seek help on their own. The program saves lives, it reduces hospitalizations and jail time, and it replaces judgment with support. We basically passed that bill, and I know that the ACLU and many others, the public defender, many others fought us. But what the bill does is that those people, and we have about 700 of them in the state of Maryland that are in and out of the court system, they're in the hospital, they end up in the court system, and they're not criminals. They're just people that need support. They need a doctor. They need to have their behavioral health addressed. And if they were to take their medication or have some type of services, they will be out of the court and in the community and will be productive citizens, and they deserve that. The bill was drafted in a way that it doesn't compel anyone to do it, but it does incentivize them to say, if you go through this program with the courts and the hospitals and the Department of Health, and you take your medication, and you actually seek the care you need, and we will pay for it, we would eventually get rid of that court case, right? And the bill passed, and I'm very proud of that. It took us 24 years. And I threatened the public defender, I threatened the LCOU, and I threatened many other people that were against it, that I will continue to fight for it, and I will shame them, because this is simply the right thing to do. The governor committed $3 million to it. It will provide the care people need, but also the money can be used for housing, right? Which is so important. And that was a priority for us. We also, through the Collaborative Care Pilot Program, we are reimagining how behavioral health fits in everyday medicine. We are embedding what the program does, mental health professionals into primary care, right? What a concept. That your primary care office, that practice will have also a healthcare professional. And why did we do that? Because someone that is struggling is, to be seen, to be heard, it is tough to find that help. And we want to make it easier for people to be in that primary care practice and have the access so that we can make that connection. We can pass that patient, right? This is what a patient-centered future looks like, right? Where everything is in one place. That is my vision for Maryland. We have also launched and support it and fund it. And I defended the bill on the floor, and Delegate Wood supported all these bills. The 988 Suicide and Crisis Lifeline, a lifeline in every sense of the word, available around the clock, 7 days a week, 24 hours a day, and one single 3-digit number that people can call. It connects people in crisis with trained counselors who can de-escalate and will give support and guide them to safety. And it is just one piece of Maryland's evolving behavioral health model, which is creating a streamlined system where no one falls through the crack. And that's the problem, is that people fall through the crack because there's no continuity, there's no support, there's no follow-up. In Prince George's County and across the state, we still see far too many barriers to care, especially in Prince George's County, where we lack primary care doctors, where it is a county majority of color, where we have a lot of chronic illnesses. And we are putting a lot of money into the hospital in Largo, but we need more than that. And it's important because our residents deserve the same care that a lot of people are getting. And that is why our legislative work is so important. Each year, our committee takes on mental health in some form or fashion. It is always a priority for us, for me, from ensuring the most vulnerable individuals receive the treatment they need to expanding access for everyone, regardless of where they live. The laws we pass address tough and often complex issues, and we're never afraid to ask the hard questions. I'm not. Delegate Woods is not. My committee's not. My leadership is not. Our communities deserve nothing less than full accountability and meaningful impact. This session, we focus a lot on those kids that you read about. You have seen it in the paper. They get stuck in the ER. And a lot of them are foster care children that are abandoned by the foster care parent, or the residential treatment center doesn't have the space. And some of them end up there, their ages are 6 to 19, sometimes 21, for 6, 7 months in a hospital. Can you imagine that child not being able to go outside and play, not be with its peers, not going to school? So I and Delegate Woods and many others in the Senate and the House, we worked very hard on this bill. It was a pediatric overstay bill. And it's a bill that, will provide personnel to take these cases and try to find housing and placement, but it also put in $6 million for us to be able to hire staff and work on reducing the number of kids that are left in the hospital, and also in hotels, okay, which some of those foster children are. It was a priority to me. I actually threatened to boycott the second floor if the money was not found, and I meant it. I meant it because it's so important. We also passed legislation this session that directly support families at home, whether it's expanding access to community-based behavioral health services, improving insurance coverage. We did so much of that this session, or investing in provider workforce development. My goal, frankly, is to ensure that no family is left behind. In Prince George's County, we have seen mobile crisis teams, more school-based behavioral health programs. Those come out of my committee as well, and I'm very proud of that work. And greater partnerships between local providers and state agencies. And, these efforts are saving lives. None of this can happen in isolation. Collaboration is the foundation of progress. We need agencies, providers, families, educators, and advocates to be at the table. And we work really hard on my committee to do that, because mental health touches everyone. It touches, every single person in this system, in this life. So I just want to say that I am very committed to this work. And I am with you. I see you. I and Delegate Woods and others will never stop fighting for what's right. So as long as I'm there, you have a voice, and we need partners. So, thank you so much for giving us the time. We really appreciate you.
Thank you so much for all of the legislation that you've been putting forth. I took a lot of notes, a lot of things that I want to circle back and talk with you about. I do know that you had to leave.
I have
Would you
time
be
for a couple of
Yes.
questions.
Awesome. Thank you so much. Is there anybody that would like to ask a couple questions before we move on to our next speaker? Buddy. All right. Well, if nobody has any questions, I know that some people may just not want to ask online right now, but feel free to send them my way. And we'll make sure to get them over to, oh, Lauren has her hand raised. All right. Go ahead, Lauren.
Hi, Calandra. Thank you so much for hosting this. And Delegate Peña Melnyk, thank you so much for being here. Um, as a registered nurse, I work in cardiac surgery, but obviously mental health affects all patients. I have noticed, though, working in the hospital that people don't get like psych care if they're not on a psych unit. So I'm not sure. I just am identifying an area for improvement. Not sure what suggestions I have yet, but I just wanted to bring that to your attention.
So it's funny, it's interesting you say that. I have been working with Delegate Woods and others on a mental health registry, and the RFP has just been issued. And it was a bill that I introduced in 2019, House Bill 11, I think it was 1121. And that is supposed to address the lack of beds and care. But one of the things that they're looking at is having some triage for behavioral health in the emergency rooms, which will help what you just brought up. And it's an issue that a lot of nurses and doctors have brought up to us. I have been working with the Department of Health on this particular issue. So thank you so much for bringing it up.
Thank you so much.
And thank you for being a nurse. It's so hard to be a nurse during this time. And especially with everything that is happening in the country. And for the counselors and social workers, like Delegate Woods, thank you for what you do, because it takes a toll emotionally.
Okay. I have a question that can go towards both of you while we're here. How can young people like us and community members support or advocate for mental health legislation more on our local levels and on a state level?
Since I spoke so much, and the last one, Delegate Woods, you want to take that, and then I'll take it.
Sure. I think that what is important is that we as a people continue to encourage young people to let them know that their voice matters in Annapolis also. I sponsored a bill this year that was brought to me by a teenager. And young people need to know that they ask very legitimate, concerning questions. And we as adults, we as advocates must be very adamant about allowing them to understand the importance of sharing their concerns, allowing us to understand the importance of making us stop and say, look, we need to address this. We have young people, then Delegate Peña Melnyk will tell you, we have young people that come to Annapolis and testify for bills whose testimony is more powerful than some of the adults that come to the table. Lived experience means everything. And so I think it's extremely important that we, number one, are able to acknowledge people's lived experience. allow young people to know that we really are concerned about the things that matter to them. We are concerned about the things that keep young people up at night. It used to drive me crazy. And I don't know if anybody else on this call has had this experience, but I was constantly told, you're too young to be worrying about this. You're too young. Listen, young people worry. Young people have fears. Their worries and their fears and their concerns absolutely positively impact their mental health, impact their ability to be able to study in school, to concentrate in school, to maintain, to achieve and maintain significant relationships. And so it is our job to encourage our young people. It is our job to be able to acknowledge every experience and not to be judgmental or tell young people what they should or shouldn't do or should or shouldn't, what they should or shouldn't feel. I can say this, despite the challenges that I had as a young person, can I honestly tell you that some of the things that young people go through today, I just have to shake my head. Despite all of the things that I had to deal with, some of the things that our young people have to deal with today unfiltered, that we just simply did not see, that we simply did not experience when I was coming up in the early 60s. I didn't just tell on myself with my age, but I didn't have to deal with some. Listen, let me tell y'all something. When I grew up, at 10 o'clock at night, I think I'm a little older than Chair Peña Melnyk also, but at 10 o'clock at night, the television would go from whatever was on to fuzz. And right before that, you'd hear dun, 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 dun. That lets you know you're not going to see nothing else tonight. Young people are exposed to things tonight, to now during the day that we never were exposed to. And so they have to navigate these challenges in a very different way. And I think it's extremely important. I don't want to belabor the moment, that it's extremely important that we are very careful to acknowledge their experiences and to listen, because they can make some wonderful recommendations regarding positive change in our communities.
That is very well said. I would just add that you can, support organizations that have been working on these issues for a very long time in Maryland, such as, the Mental Health Association of Maryland, NAMI, as well, right? There's also Community Behavioral Health Association of Maryland, and those organizations often give opinions in Annapolis. They often write letters. You can support policies. You can write a letter from your organization. You can come and give when you see the bills. You can call the library, and I hope you know this. You can ask them what bills have been introduced, or regarding mental health. Like you can call behavioral health. You can call in January, the last week of January, first week of February, right? When we're introducing these bills. So you can get a list of them and you can write a letter from your organization. And some of you have experience, have gone through life and have had, behavioral health as part of your life, have experienced it. Talk from your heart. Okay, that testimony is so powerful, right? So you can support that, you can participate, connect with others, with those organizations that I just said. You can, build support through social media, right? Like also do posting for social media as well. Do a little research and see if Maryland is not doing something that is being done, for example, in Washington, D.C., in Virginia, in Delaware. We try to do that, but are there policies that others are doing that we're not doing? Because oftentimes you don't have to reinvent the wheels, right? You just cut and paste, and try to, tell us, what you think it's important. And pick a date of action during session, January to April. Pick one day where your organization comes and you advocate for behavioral health, okay? And you go see, people on the different committees and bring, some attention to it as well. When we have press conferences on these issues, make sure that you join as well and be part of the agenda. There's so much that you can do. You know, you are the future. You young, amazing professionals are the future. Okay.
Can I just add one
Thank you
more
so
thing?
much.
Can
Oh,
I,
yes.
can I add one more thing? I think when
Mhm.
we talk about specifically, as Chair Peña was saying, some of the things that we can do, what we have to recognize is that we have to make sure that we implement a full scale acknowledgement and acceptance of the need for behavioral health crisis services. We must make sure that we get the appropriate funding, that we overhaul our system so that we get rid of all of the stigma and shame that prevents people from moving forward. Since Chair Peña also talked about like things like telehealth services, we need to make those a priority in all of the advocating that takes place as a result, as it relates to behavioral health. Thank you.
Thank you. I know we are a little over our time. We have one more question while I still have both of you here before we move on to Michelle. Um, this is a question that was sent on social media. Um, she says something she's been thinking a lot about is how are we addressing cultural and language barriers when it comes to equitable access to mental health care? And are there any programs in place that provide materials in different languages, offer implicit bias training for providers, or bring services like mobile clinics into underserved communities? And then the second part is also how can we better support immigrants or undocumented individuals in this space? Do any of the legislative efforts or protections being discussed extend to them as well? And yes, that is the end of the question.
So I'm going to take that one, Delegate Woods, because I introduced a bill that Delegate Woods supported that requires implicit bias training for all healthcare providers in the state of Maryland. And that is the law. Okay. And we had to fight hard to make sure we got support from different organizations because, you know, they don't want new training, right? Doctors and nurses and other, professionals do not want new training, but we told them why it was important. But this session, even given what's happening at the federal level with DEI and everything else, I also introduced a bill that requires structural racism training for all healthcare providers. And that is really important. So we have done a lot. Also, we passed a bill this session that will require requires language access and state government. And that bill is going to be managed and implemented by the Office of Immigrant Affairs, which was another bill that I introduced that created an Office of Immigrant Affairs in the state of Maryland, and it has a director. And by the way, there's 5 positions that are going to be advertised next week because they're going to be hiring for 5 full-time people because we need it, especially during these times. And Delegate Woods has supported all these bills and has fought hard and helped me. I could not do it without her. The other regarding undocumented individuals, the Latino Caucus, which Delegate Woods and I are proud members of the Latino Caucus. We're proud members of the Black Caucus as a Black Latina. I am a member, and we work closely together. We actually introduced several bills regarding undocumented individuals to give protection to them this session. Sensitive places, right? The U visa and many others. Regarding healthcare, I introduced a bill that allows, for example, pregnant women, undocumented pregnant women, which, by the way, they're not all Latinas. There's a lot of undocumented people that are from Africa, the Middle East. Okay, so people are mistaken when they think that it's all Latinos. Documented women to be able to get Medicaid while they're pregnant and 4 months after they give birth as well, and some other programs that we have implemented in Maryland. So we're very much aware of it and care very much about everyone in the state of Maryland.
Thank you all so much for answering all of those great questions. I will turn it over to Karen to move things along.
Thank you so much, Delegate Peña Melnyk, and thank you so much, Calandra. We're now excited to move on to the next part of our agenda. And our next speaker here is Michelle Whittaker. She's the Executive Director of Ranked Choice Voting Maryland. Michelle is a nationally respected advocate for electoral reform and leads Ranked Choice Voting Maryland's efforts to educate and empower voters through ranked choice voting. So really excited to have you with us and learn from you tonight.
Thank you, Karen. Thank you, Calandra. And thank you all for allowing me to have some time here. I was listening into the entire discussion on mental health, and it's really great to hear what our legislators at the state level are doing. And while you may think, well, what's the tie in with ranked choice voting? One of the most important things that you need to think about is like our elections should reflect what we want to see happen, whether it's the local level, the county level, or the state level, and making sure that the priorities for our communities are addressed and part of the conversation and part of policy, making good policy at every level. And so I'm going to talk a little bit about how ranked choice voting can be part of creating those systems and government that really is responsive to your needs. So let me just make sure, I think, yes, I have the ability to share. So let me share my screen. Give me 1 second. Oops. Slideshow. Okay. Always takes a minute to get that in. All right. And can you see my screen? Yep.
Yes.
Okay, great. Okay. So we're going to talk about ranked choice voting. I will share my information more about that, but I'll also just say, like, I'm a member of the Montgomery County Democratic Central Committee, so very engaged with at the party level, as well as my work at a professional level with Ranked Choice Voting Maryland. And I've done work on campaigns across the state, as well as in DC, and working on national level campaigns, not on ranked choice voting specifically, but on just helping candidates, particularly Black women, be able to run and win elected office. And then, making sure that we're training women and people of color to be strong candidates wherever they're running. So lots of great work that I've been able to do to help my own community, but to help communities across the country. So, the first thing I like to kind of level set with folks is to remind us that every day we are making choices. We make choices about, what type of drink that we want, what choices we're going to have for dinner, or, for many of you who may have just finished college, or you're getting ready, or you have siblings who are getting ready to go to college, you may be making choices about which school you're going to go to and what are the, benefits of going to this school versus that school. We make those choices every day, and we have what might be our top choice, our next choice, and so on. And we get that reflected in what we do. We might go to the coffee shop and our favorite beverage is not available, but we still have something else that we want to get. We don't necessarily walk out of the store and just say, well, they don't have what I want, so I'm not getting anything. We usually have another backup choice that we're interested in, that to drink or whatever it is. But in our elections, many times we don't have that benefit of choices and having backup choices and being able to express our opinion about that. And that's really where ranked choice voting comes into play. It helps to improve our election experience for both voters and candidates by allowing voters to fully express their choices. So especially when you have races with multiple candidates, you can say, here's my top choice, here's my next choice, and so on. And for candidates running, you really see a change in how they're running in the race, because you're seeing less negative campaigning. You're seeing a lot more of a connection to, like, if you have a top choice, that's great. And here's how I can be your next choice. And candidates are actually campaigning that way, or campaigning together to show, like, here's the combination of candidates who identify with what you're interested in as a voter, and really kind of moving the discussion on the issues rather than kind of the lowest denominator of cutting down people, whether you're talking about a primary or general election. So one of the best ways to kind of understand how ranked choice voting works is to try it. And so I'm going to put a link in here real quick. Whoops. Or maybe I'm just showing it, but let me put it in here for everybody. So if you want to vote in this election, this is just showing, do you guys see the ballot now, right? Yes.
Yes.
Okay. So this is a tool that we often use at Ranked Choice Voting. It's provided through this organization called Ranked Vote, which just provides an online tool. If you're ever interested in using this, you can sign up for a free account, make your own RCV polls, and see how it works. We've created a very simple one that's just, ranking your favorite beverages here. And as you can see in the ballot, you have a choice of like, what's your first choice, your second choice, third, fourth choice, and so on. And you kind of select one in each bubble. I'm just going to do this for myself. That's going to be my third choice. This is my second choice. There's my fourth choice. And hot chocolate isn't really my choice because it's not the season for hot chocolate for me right now, right? So I can submit this. And then I voted, and if you're still voting, that's fine, but I'm going to just show you the results because we have lots of folks who've been participating in this. So in our ranked choice voting election that we've been running, water comes out as the winner. And I want to just show you how we got to that choice. So if we see in this first round here, the goal is to get to the threshold, which for this election is getting a majority of the vote. Majority of the vote is having 50% plus one. And so that's where the winner needs to get to that total. What happens is that when after all the votes come in, you tally all the votes in the first round and you see if does anyone have a majority of the vote. If you look at this in the first round, water has 66 votes, coffee is next with 55 votes, but no one's reached the threshold, which is 108 votes because of the number of people who've cast ballots in this election. So it kicks off an instant runoff where the candidate with the least number of votes is eliminated. In this case, it's hot chocolate, and there are 24 votes for hot chocolate. What happens is, and this is the beauty of ranked choice voting, is that anyone who had hot chocolate as their top choice now has their next choice considered. And so hot chocolate had a lot of people who like tea, lattes, water, and coffee, but still we're not at a majority. No one's won with a majority. So we eliminate latte. When we eliminate latte, coffee takes a lead here. Water is right behind, and tea is in third place. We still don't have a majority, so we do another round. We're eliminating tea. We eliminate tea, and when we eliminate tea, most of the voters who had tea as their top choice had water as their next choice, and so water wins in this ranked choice voting election that we have. And as you can see, we're reaching a consensus where there is a majority of voters who wanted water, whether it was their first choice or their backup choice. But everybody who was participating in this election has their voice heard. All first choices are counted, and depending on how the elimination goes, you have your second or potentially third choice if you have multiple candidates that are eliminated considered in that election. So we did talk about that. Here's again, like giving the simple explanation. What do you do as a voter? You rank your candidates, and you have an understanding of this. When you are meeting candidates at different events, you have a sense of who's really your top choice and who you really like and would love to see them in office, and who maybe your backups are that you think have good policies and you want to see. But that's what candidates do. They're able to rank their candidates in order of their preference. After you rank all the candidates, all the ballots come in, and you tally all the first choices and you see if there's a majority. And as I said, if a candidate reaches that majority threshold, they win. If no one does, that instant runoff kicks off. And the benefit of really using ranked choice voting is that voters are able to fully express their preferences more, and you get a candidate who wins by consensus because a majority of voters have said that they wanted that candidate, whether you're looking at their top choice or their backup choice. So, whoops, just go. So one quick thing, just to give you a sense of where RCV is used, it's in over 50 jurisdictions across the United States. Alaska has adopted it statewide along with Maine. And then here in Maryland, we have Tacoma Park, which has been using ranked choice voting for close to 2 decades. And there are multiple cities that have been adopting it over the years, including our neighbor, Washington, D.C., which they adopted it, passed it through referendum in 2024, and now they're in the process of doing their implementation and funding for ranked choice voting. So let me talk a little bit more about the benefits. Less toxic campaigning. You win by making connections and talking about the issues. You're going and talking to voters about like, hey, if I'm not your top choice, at least hopefully I can be your next choice because of these reasons. So you're really trying to connect with more voters. There's less negative campaigning because if you're campaigning negatively, you're going to turn off voters who could be, make the difference in terms of having that extra backup support, and you won't get that. And you have candidates who really do engage in the more meaningful conversations because it's not about mudslinging and the lowest common denominator in the election. It's really about making sure you're making the real case about the issues. In addition, whoops, my screen is freezing. The benefits also around like who's really participating. So one thing that we see is younger voters are more likely to participate in ranked choice voting elections. We see this in many of the cities that have adopted ranked choice voting. More voters are engaged, young voters in particular, because they see this as an opportunity to help bring about the issues and the concerns that they have in their particular communities. We also see that it develops a new way of campaigning. And so again, if you've been out there on the doors, if you see somebody, a house with the sign for your opponent, you're usually like going to mark that as like, this house is already for somebody else and you're moving on to the next one. With ranked choice voting, you're really moving, you're considering all of those, and you want to be able to talk to those voters and hopefully get them to support your candidate as well. So it's got great benefits that way. And then a more representative government. You have more candidates who are willing to run, particularly women and people of color have been running and winning in ranked choice voting elections. We have great data on that I'm happy to share with you all, of reports that have been done for organizations like Represent Women and Fair Vote, which are two national organizations that focus on electoral reform and increasing participation for women. And then it lowers the barrier for underrepresented groups. And particularly, this is not only about candidates being able to run, but communities being able to say that they actually have a choice and will elect somebody who reflects their community. And one of the great examples of this is most recently in Portland, Oregon, which adopted this and used this in their recent city elections. And they had a number of young people of color who were elected from diversely across the city. And it's really transforming how they're having discussions about issues around housing, around social services, around transportation, around development, all of that. And that's because now, along with other changes that they've made, they have a system of voting that allows them to really elect people who reflect their communities. And as I mentioned, more women and more people of color. New York is one of the great examples of this as well. It became the first majority women and majority people of color council in New York City. And that was after the ranked choice voting election. And Minneapolis has had multiple elections where they've been able to elect people of color and have a majority on that council as well. So where do we see split voting in crowded fields? Well, I'm going to give you a couple examples. This first one is showing the GOP race in 2016, where we see Donald Trump is winning with 35% of the vote, when you see 62% of the voters in that election in the primary really chose somebody else. So again, it's showing the dynamic of what we're doing, is we have a process that doesn't help us really reflect who the majority of voters want to see win in that election. But this also happens at a local level. So here's an example of a crowded field in the Democratic primary for governor in 2022. And you see Wes Moore won with 32%. And there, among the other candidates that you were running, there were 67% of the voters chose someone else. Now, I want to just also point out that this isn't necessarily talking about who is getting elected, and like it's not a referendum on the person, it's about the system. We really want a system that reflects voters electing somebody with a majority of the vote. And whether you're talking about a primary or general race, you want to see that in the results, and you want to see that there's a consensus around the candidate. Also, it changes the dynamic of running, because we know in primaries, you're often making these, trying to make these differences among your candidates. And then sometimes it can get really ugly, and it could damage or really hurt your candidate going into the general election because of all of the mudslinging and negative campaigning that happened in the primary. So there's a way where if you're using ranked choice voting, again, it's about building consensus, talking about the issues, and it can really have a positive effect. Another example here, we look at Baltimore City, again, another really crowded field. We have Mayor Scott winning with 29% of the vote, and again, 69% of the vote. Voters were voting for someone else. And then one more example for you is in Prince George's County, with most recently with the county executive race. We had Aisha Braveboy win with 46% of the vote, very close to getting to a majority. But again, just want to point out that there were 53% of the voters who were voting for someone else. And I was at several of the candidate forums and talking about how if we had ranked choice voting, that would be a great opportunity to really build more consensus and elect somebody who really reflects, again, like gains a majority of the vote in that election. It's not about the person, it's about the process and making sure that we have a process that really helps the candidate go into office or into the next election with that support behind them, and also that voters have their voices heard. Along with just like where there are examples that we can look at how our elections right now, we have broad support across the state. Brooke Learman has been a strong supporter when she was both a delegate in Baltimore City, and now as comptroller, she's been a really great advocate and believes that this is truly an investment in our government. In Montgomery County, we have State Senator Will Smith, who's been a strong supporter and, obviously understands this context from having Tacoma Park as part of his district and seeing the impact that it's had on residents there. And Delegate Janelle Wilkins, who's the chair of the Elections Law Subcommittee, has really spoken up about the benefits of this. And we're hoping that she, along with others, will continue to be a champion for us. And so that's kind of the brief presentation. Hopefully you got a good sense of it. If you're interested in getting involved in our work, I know we posted information and I was trying to get through this as quickly as possible. But the last thing I want to share is, and I think let me just exit out real quick. And where did it go? I lost the slide. No, I lost the slide. Well, let me there it is. Okay. Let me talk about the opportunities. So we have opportunities in Maryland to move forward in cities, particularly Annapolis, Hyattsville, Rockville, and the city of Frederick are all, we have legislators who are working on introducing bills or language to adopt this into their charter. So we're really excited about those opportunities. And so for you all in Prince George's County, I hope you'll take a look at what we're doing in Hyattsville. Paul, who's on the call here, can be a great kind of connection to see what we're doing, but we'd love for you to get involved in any of our work that we're doing across the state. And we're also looking at opportunities to go back to the General Assembly to introduce county enabling bills that will help either a single jurisdiction or multiple jurisdictions have the ability to use ranked choice voting. So just if you're not familiar with this, our charter cities can make changes to their elections and they don't have to go through the state for approval. But at the county level, for any changes to our county elections, they need to get enabling legislation approved at the state level. And so that's one of our activities, is making sure that we're continuing to push that forward in jurisdictions where we know folks are looking at it. And you all can be a part of making sure that that happens at the state level, but also at cities, by using your voice and saying why this is important or why you see there's an opportunity, or encouraging a discussion to happen at all levels. So I will just pause there, and happy to take any questions. And I really do appreciate the time. So.
Of course. Thank you so much for your presentation, Michelle. Thank you for your advocacy. I do see our first question from Deli. Go ahead and you can unmute yourself, Deli.
Thank you. Thank you, Calandra and PGCYD, for putting on this amazing, informative event. Michelle, hey, Deli Okafor from Baltimore here. Thank you for this presentation. I want to really make sure I understand how ranked choice voting plays out in practice. So I was wondering, if we're looking at a race like Aisha Braveboy's or Westmore's, or one of the ones that you referenced in this presentation, I'm curious about for the outcome, would it have stayed the same? Like, would we have ended up with the same person, or would a different candidate have won under a ranked choice voting system?
So great question, Deli, and great to see you online. One of the main things that I point out with people is when I'm looking and I show examples of past elections, I don't make a reference that there might be a different outcome because you're looking at apples and oranges. Voters came into that election and they voted a certain way, right? And when you're asking them to do a ranked choice voting election, they are going to be voting a different way. What we can say is that obviously in an election where you have a crowded field, whether you're talking about the Prince George's special election or the Baltimore City mayoral election, is that you have split voting and you probably have multiple candidates who have similar interests, and a voter is going into that, into the voting booth and they're like, I've got to pick one and I've got to figure out who's going to be the most likely to win. That may not be their top choice. They may be like, I really like, some other candidate who's on the list, but they feel like voting for that person is going to impact whether or not, somebody else that they really don't want to see win is going to have more of a chance. So there's this strategic voting that happens often in elections without ranked choice voting. And this eliminates that strategic voting aspect because you really vote your true preference. Even if there's a candidate that you're like, I really like this candidate and what they're talking about, but I'm not sure if they're going to win, you can still say like, that's my top choice. And if they don't make it, here's my backup choice who I do like what they're talking about too. And, I support them. So, the outcomes, they could be the same or they could be different. The one thing that will be different is that you'll have a majority winner. And that's what we really want to see in elections, especially when you're electing a mayor or a governor or senator, is that you want to see somebody win with a majority, because that means that they have a majority consensus of the electorate in whatever that election is. And that's really different than saying like, oh, I won with 30% of the vote. And that's what we do right now with the most votes wins. And again, not about the person, but our process and making sure that we really are able to show like, here's the candidate who has that broad consensus.
Got it. Thank you so much.
Yeah. And let me just post here, we have some upcoming events. Some of our events right now in June are in Rockville and Annapolis, because we have a couple of, as I mentioned, there's some activity that we're focusing on. But we also are doing events in Hyattsville, and I think we'll be in Hyattsville later in the summer. But we're excited if there's an opportunity and you all would love to help host an event, whether it's a video screening or doing an in-person, fun social where we rank our favorite beverages at a local bar or wherever. Happy to help put that on for you all and connect with you. But, there's lots of opportunities for you to engage in this conversation. I hope you'll continue to talk with people and just ask them like where they are, what they know. And if there's an opportunity or they want to know more, connect them with me. I'm happy to have a conversation.
Thank you. I do like that idea, so I will be open to reaching out to you about that. There is one other question from our Executive Vice President, Rashad. Go ahead, unmute yourself.
Good afternoon, everybody. Good evening, rather. Michelle, first of all, thank you so much for taking the time to come out and speak to us. I am extraordinarily passionate about ranked choice voting. Right now, our elections are mostly apples and oranges. The main problem I have with that is I like fruit. So if you tell me there's just apples here and oranges there and make me pick between them, I'm having a hard time because I like apples and oranges. And I want to make sure that everybody has a chance to truly pick and choose their best representation.
Yeah.
Just to give a short example, we just had municipal elections in New Carrollton. For the first time that I can remember in ages, we had 3 candidates running for mayor, and the totals ended up being 275, 266, 141. There was a lot of variance in between those 3 candidates, and I can't help but imagine what the outcome would have looked like if everybody got to rank their votes and say, hey, this is who I like the most. This is my backup. this is my third person. There's stuff that I like about each person, what they bring to the table. Let's let the best one win. So it's honestly something that I would love to work with you about trying to establish in New Carrollton. That's where I live. I'm
Awesome.
extremely passionate about it and would do virtually anything to help see it through. And I also would love to see, just in our own organization, with the Young Democrats of Maryland, this is a process that we should use in our own elections. We just had our convention not but 2 weeks ago and elected a new state board. And these and having choices like this is something that we should have presented to the state to show as an example of, hey, this is how you get the most buy-in from everybody. Because right now we're turning around and saying, hey, you get to choose between one or two. That doesn't work for everybody. You
Yeah.
can even see it in the variety in in places that we shop. You don't go into a place like Kohl's and say, I'm going to get either this green t-shirt or this red one. You have a ton of options.
Yeah.
So how can we best go about helping to grow this movement? How can we best go about um, engaging with municipalities to help adopt this? How can we best go about talking to our state delegates to continue to push this? How do we get this done? Because we
Yeah.
need this done.
Thank you. A great question. And what I will say, and Paul's a great example of this, we've done a lot of canvassing and community conversations, and that's one of the key pieces going around. We are working festivals and different events and like just being present and sharing our material and talking about what's happening. And that's where we've made connections with elected leaders in Hyattsville, in College Park, in I'm trying to think of the other city, Greenbelt. I think we've also been in conversations with them, along with the folks in Annapolis and Rockville and others. And so really it's about building like kind of that community conversation and doing that work. So would love if there's some opportunities or events that you know of that are happening in New Carrollton, let me know. We can see how we can get some folks out to something that would help us to talk to community members as well as get in front of the city council and things. And then, in addition, supporting what we're doing at, whether it's a state level or in cities. So if there's a city that's nearby that is working on this, helping to support the local effort there is great because we do need people who are helping to do canvassing or working at events when we have that. And then when we have state legislation, which we are planning to introduce for 2026, we will gladly share that with you all. And again, talking to your delegates that particularly are on the Ways and Means Committee, as well as your senators, is going to be key to make sure that they know that this is supported. And we're right now trying to see if we can put together a multi-county bill that may be like Anne Arundel, Montgomery County, and Howard County. We're just trying to see what legislators might be interested. But we'll let you know, and would happy to see how we can move that forward. In Prince George's County, I've had some good conversations with legislators there, and I'm continuing to work with them to see like what questions that they have and how they might be supportive of the action. I will say that many of the conversations at the state level have been, we want to see how it can be implemented locally and how it's working before they do a state level enabling bill. So that's why, again, we're working in cities and we have the opportunity in Annapolis, Hyattsville, and Rockville to potentially adopt this by the end of the year and have Rockville maybe using it by 2027, and other cities might be using it even sooner, depending on when their next election is. So lots of great opportunities. Please, I put my email and phone number. Please reach out to me and we can talk more, but would be happy to come to New Carrollton. I go all over the state. I'm happy to travel everywhere or do Zoom calls, but I love going around and talking to people about ranked choice voting, if you can tell. And so I'm happy to do this and just share more with any group that you want to, because I think it's important to have that conversation. And as you said, like, not understanding the difference and what's possible in our elections, because we can make our elections better so that voters feel like they can fully express their votes. And we can make it better so that people see that we have somebody who's being elected with a majority of the vote and really has that consensus going in and a clear mandate to go in and do the work and represent all of their community in whatever context that is. So we're hoping that we can do that and see more people of color, more women be able to run and win. And those are all the great benefits that we've seen with hard evidence over the last 2 decades happen in cities across the United States. So.
Thank you. There is one more question that came in, and I'm not going to take up everybody's time tonight. I know it's getting late. Um, can you explain how ranked choice voting works in elections where there are multiple winners? Like, for example, city council or school board with more than one seat. How does the counting process change, and what are the benefits of using RCV in those kinds of situations?
Yeah, so the simple kind of explanation is what in a multi-winner race, it creates a fair representation model, a proportional winners in the system. So it's, there's a threshold that I talk about. And so in a single winner race, that's having a majority, which is 50% plus one. In a multi-winner race, what you have is that there's a situation where there's a mathematical number. So if you have 4 seats available, there's no more than 4 people that can win if they get 25% plus 1 of the vote, if I'm doing the math right, or 24% plus 1 of the vote. I'm doing the math wrong, but so I don't want to do that in my head. But that it's a proportional system, and so you have to get to that threshold in order to win. And what happens in that case, and Portland, Oregon is again the newest example of using the proportional system. You have diverse candidates who are elected, women, people of color, people from underrepresented communities, and they represent different parts, and they're equally getting a seat by winning that threshold. So that's the simple answer. Happy to, like, the voting process is the same for everybody. You rank your candidates. It's just coming in when the threshold is different, and how you're doing the transfers of vote can be slightly different in that process. So, but happy to do a presentation on that in the future. And I think we may have an example of that on our website, but if not, I'll share information on that. So that's the quick answer.
Thank you. Thank you so much. Um, Before we wrap things up, does anybody else have any questions? We still have Delegate Woods on the call as well. So if you have any questions for Delegate Woods or for Michelle Whittaker. All right. So I will go ahead and close this out. Again, I'm just very thankful that Delegate Jamila Woods, Delegate Joseline Melnyk, Executive Director Michelle Whittaker were all able to share their time with us tonight. We were able to hold space for both healing and action at the same time. I appreciated that Michelle brought up the connection of us having an event that is having a discussion about mental health, but also civic engagement, because the two they do have a tie together. And we were able to recognize how deeply our mental health impacts our communities, learning how tools like RCV can strengthen our democracy and give people real choice and voice at the ballot box. And lastly, I just want to leave everybody with the reminder of caring for your mental health is a form of our advocacy. Staying civically engaged, even when it's difficult, is an act of self and community care. So if you were moved by anything that you heard tonight, don't let it stop here. Have a conversation with someone. My line is always open. Share what you've learned today. And most importantly, let's stay connected. And, follow up with any of the resources. I dropped some mental health resources in the chat, along with all of the contact information for all of our speakers tonight. So just once again, thank you to everyone who came out tonight. Take care of yourselves, and we will see you at our next meeting, our next discussion. Thank you so much.